Good morning, everybody. Really great to be here. Really a big day for Nebraskans. I'm joined here today with Attorney General Mike Hilgers and Director of Health and Human Services Steve Coursey. It's really simple. We're taking a very bold step in Nebraska to enhance creating our culture of life and love. Some will say, what on earth does this mean? Well, it's really simple. Simply recognition of all human life that has value and requires our protection at every single stage. Today we're taking action that will protect the unborn and expectant mothers because that's who we are in Nebraska in our culture of life and love. We are grounded on faith, family, freedom, life, and love in the pursuit of unending happiness. We as taxpayers should not be funding abortion services, period. Pure and simple. That's why I'm signing an executive order today directing the Department of Health and Human Services to immediately review whether abortion providers terminated from Medicaid in other states, like South Carolina, that are still participating in our program. And let me be clear, they should not be. So federal law and Nebraska law and regulations are crystal clear. If a provider is kicked out of Medicaid anywhere in the country, they don't get to come here and keep taking Nebraska taxpayer dollars. That's the kind of reciprocity we work with in Nebraska. That's program integrity, and that's exactly what this order enforces. Under this executive order, any provider, including abortion clinics, terminated from another state's Medicaid program will have their enrollment terminated here in Nebraska. Nebraska stands proudly as a pro-life state. We've enshrined protections for the unborn in our Constitution, and we're not going to let abortion providers skirt accountability while claiming our money. That's the culture of life and love we're building together here in Nebraska. Before I invite Attorney General Hilgers up to the podium, I want to stress Nebraska has ample resources for women who need health care services. There's 12 clinics across Omaha that have providing levels of service for young women in need, and there's another 4 here in the city of Lincoln, and we have extraordinary services across the great state of Nebraska. I think it's really important. CEO Steve Coursey from the Department of Health and Human Services here can attest to the numerous places, the resources available through his agency's website. So I also, his website includes information specifically to support healthy pregnancies even after deliveries. Really proud of Attorney General Hilgers and his team's work. Mike, thank you.
Thank you, Governor. Thank you. Good morning, everyone. Today is a really good day. It's a great day for Nebraska families. It's a great day for Nebraska taxpayers. And most importantly, it's a great day for Nebraska unborn babies. Today is a culmination of years of work to ensure that Nebraska taxpayers no longer have their tax dollars going to fund abortions in the state of Nebraska. It's a fight that has gone on even from my time in the legislature when we first got Title X funds. We stopped Title X from going to abortion providers, and now, thanks to Governor Pillen's leadership, we have finally gotten to a place where taxpayer funds will no longer support abortions. And before I go into some of my comments, I just want to thank Governor Pillen and his team. Governor Pillen has been absolutely a rock on so many issues, but this issue in particular. You've spoken so well about families, about protecting babies, about fighting for babies, about moms, and we couldn't have done it without your leadership, Governor. So thank you very much. You and your team have been outstanding. I just want to give you a little bit of a legal background. There's a lot to say. I won't bore you with all of the legal details, but I think some of it does also dictate a little bit on the timing. So I just want to kind of give you a little background, and then we can take your questions. So this has been an issue that's been in the background for a long time for a lot of people. In fact, the prohibition or the desire of Nebraska taxpayers to not have their funds be used for abortions has been in state statutes for some time. But this year, a couple of things I think have happened to help make this a reality. Number one, earlier this year, the big beautiful bill was passed at the federal level. That had a very clear prohibition of federal funds, federal taxpayer dollars, from going to abortion. That was initially enjoined, but the First Circuit has actually held that to be the law of the land. So that was number one. Number two, the United States Supreme Court decided the Medina case earlier this month. That case just got resolved last month. And it dealt with a few technical issues of the law of these types of cases. But the bottom line of that case is that it put It allowed South Carolina's prohibition of abortion providers, or exclusion of abortion providers from their Medicaid system, to give us really another prominent legal hook to enable us to be able to do the executive, or for the governor to do the executive order today. But by excluding an affiliate of the Planned Parenthood providers here in the state of Nebraska, now under the existing rules of DHHS, who is under CEO Corsi and his team, they are the responsible agency regulating Medicaid in the state of Nebraska under existing rules now. The legal basis, we thought that this has been there for some time, but we think over the events of the last month or two, it is quite clear that Nebraska can take the action that it is taking today. I do want to make one last point to piggyback a little bit off the governor's last statement, which is there's a whole host of high-quality providers in the state of Nebraska who have survived and are functioning without providing abortion services. And I would also emphasize, especially for Nebraskans who might not be following this issue that closely, to maybe that the Planned Parenthood providers, there's been a lot of public reporting on this, and I actually have to give a lot of credit to local and national reporters who have flagged really some of the most really egregious conditions that currently exist at some of the facilities in Nebraska. Really just abhorrent conditions that put, I think, women's lives at risk, and I think have no place in the state of Nebraska. And so this is about ensuring taxpayer dollars don't go to abortions, but it's also, I think, will help get women the care that they need at places that actually will protect and support their health versus maybe what they've been getting so far. So thank you.
And I think maybe the last thing I want to say is I just could not be more proud of Nebraskans and so many Nebraska nonprofits that have stepped up in the last years, 10, 15 years, and developed extraordinary services for young moms to help them understand the culture of life and love, and to choose and to create a loving home for their baby, to get through untimely pregnancies and make it through. That's probably something in the early stages we did not do a very good job, and I'm really, really proud of the state of Nebraska and the people in Nebraska and all the work that's been done.